Obesity does not have an age limit anymore. Doctor, why are there so many obese people nowadays?
Yes. One of the main reason for obesity now is the improper diet. I say most of the people tend to, you have a very fast and very precise life right now. So you don't have the patience to cook, or you don't have the patience to follow a lot of dietary regimens. So whatever you get in order to get back to your work, before you get back to your work, you just consume that.
Easily available.
Yeah, easily. You just need everything in a like a 2 minute.
In an instant.
Yeah, everything is instant. Right now you can see even the curries that you make, the cuisines that you make, you put it in a boiling water, your curry is ready. It's so super fast right now. So everything is processed. So that I believe that is one of the main reason for the obesity. Apart from that, the sedentary lifestyle of the people. I say in olden days, whatever you eat, the people go to the field or they have a severe or very exertional way of lifestyle.
They were very active.
They were very active. And apart from right now, most of the people are having a sedentary lifestyle. They don't have the time to work on their body. They don't want to actually exert themselves. Okay, after the stress they have in their office or their workplaces, they just want to have a comfortable time for themselves. So that is another reason. Diet, the improper diet, and the sedentary lifestyle. That's two main reasons which is the base cause for obesity right now.
Doctor, what do you see in your clinics based on this obesity and the obese people? Such.
Obesity is the main reason nowadays we are seeing for type 2 diabetes, hypertension, thyroid problems, PCOS. Obesity is the main reason. As doctor said, sedentary lifestyle, food habits are causing this. Mainly, it's late night eating. It's a very prominent reason for this obesity.
Okay.
Because of this late night eatings, we have food cravings are more. Because our brain is confused, so we want more food. And hormones, the leptin is main cause of hormone for this fat cells. So this is disturbed because of this late night eatings. We have a circadian rhythm. According to this, we need sleep, good bowel habits. At least 8 hours sleep or 6 hours sound sleep is necessary. These all prevents obese. And at least 12 hours, it is better to stop eat after 7. In Siddha, it says after sunset you should not eat food. It will affect the circadian rhythm. Then a minimum of 12 hours fasting only we should eat. This will prevent obese. And as a result of this, we can prevent this many lifestyle disorders like type 2 diabetes, hypertension, thyroid, PCOS, and all.
Okay. Doctor, would you like to add something?
Yes. Say, when the patient tend to get overweight or start to become obese, it is seen that the patient, I'm not talking about all the patients, a certain group of patients tend to have the conditions of, tend to develop musculoskeletal issues. A very common condition called as osteoarthritis. The obese person are more prone for osteoarthritis. It's something that people tend to confuse. I'm getting fat, how my bones are getting affected. I'll give you an example. You see, suppose consider myself. If I'm having a huge amount of fat around my abdominal area, just imagine. I have a sequence of bones which is aligned in the back of my body, we call it as a vertebrae. Okay, this alignment, they are a small box-like bones. They are kept in position with the help of a set of muscles on either side. Okay. So the function of these muscles is to keep this box-like bones, the vertebrae, in alignment. Okay. So when there is a huge amount of fat around my abdominal area, these muscles have to strain too much to maintain that erect posture. Okay. So when this every aspect will have a limit, a threshold. When it is above that, the muscles will give away. The muscles will start to degenerate, which will cause conditions like intravertebral disc prolapse, other paraspinal muscle spasms, etc. When I talk about osteoarthritis, in that what I like to add is when this body weight is increasing, the upper body weight is increasing. Okay, so just consider my two knee joints. The knee joints are like the pillars of your body. If the whole body weight is being withheld or it is being supported by the two knee joints. Okay, so when the pressure is increased day by day, when the pressure keeps on increasing, the pressure over the bones and the cartilages is more, and the patient moves some other way. And when a lot of pressure is there and the bones tend to move, the cartilages will rub with each other again, and again the cartilages will undergo wear and tear. Okay, the cartilages, in the sense, they are a cushion-like structure which is present between the two bones of my knee joint. Okay, and this eventually start to convert into osteoarthritis. Okay. I say something is related with the fat, and see it has got an effect on the joints. So the best thing is to keep the body weight in limit, in a healthy limit.
So if an obese person comes to you,
Yes.
what kind of treatment will you recommend?
The first line of treatment will be diet management. Definitely the diet management. Apart from that, you have to maintain the digestive. The patient will have some digestive issues because of that. The fat is starting to accumulate in the body, so that has to be corrected. Then some purificatory therapies with there. Some therapies like Vamana, Virajana, Vasti, like purificatory therapies are there. That has to be undergone. And then other treatment is there. Udvartanam is there, in which we use a medicated powder for massaging the body. Apart from that, internal medications will also be there. This thing, all these are some line of management that we can use over the obese patients. But each and every patient is individual. They are unique. But so we can't apply each and everything on every patient.
True.
Okay, so we have to plan the line of management according to the patient by after seeing the patient. Okay. How he is, what can be the prognosis, everything we have to look into, because Ayurveda deal the patient as a whole. You can't just put something and take the fat away. Right. Okay, so we have to look the patient as a whole.
In overall.
Overall. Then we plan the line of management.
Okay. Doctor, what about Siddha management?
In Siddha, we have yogas, podithamridal. Physical exercise is a must to reduce obesity.
Very true.
When we have many yoga therapies also, but as doctor said, according to the patient's condition, any underlying disease condition, we have to prescribe which yoga is apt for him. And then also this physical exercise also we suggest according to this body type, and whether it is Vadadehi, Pittadehi and Kavadehi. Then also this podithamridal in Siddha, like that Udvartanam in Ayurveda. According to the patient's condition, only medical supervision we can do.
So can you recommend some internal medications?
Yes, internally we have Nirinil, Kudinir, Nattechuri Parpam, Jalamanjiri. Jalamanjiri is wonderful results giving in obese. Okay. But according to the patient, by monitoring, we can give it to the patient.
Okay. So listen to our doctors and keep your weight in check.